Nesbitt, the Deputy Mayor for Operations and Infrastructure, Lucinda Babers, and the Director of DC Homeland Security, Chris Rodriguez. We will, as I said, also at the end of the COVID update, talk about some more general government operational updates. Here, we are showing, as we do every day on coronavirus.dc.gov, the district's experience with COVID-19. You will notice that our daily case rate per 100,000 is 16.9, and we continue to watch that number go towards below 15, where you will see the red color change. It's our regular reminder to get vaccinated, to continue to follow social distancing, as well as good hand hygiene, monitoring your own wellness, staying home when sick, and getting tested when needed. Let me also show that 212,000 DC residents have been partially or fully vaccinated. You may go to vaccinate.dc.gov 855 or call 855-363-0333 to register for the district's vaccine portal. Everyone over the age of 16 and a DC resident is eligible for vaccination, and you may pre-register vaccinate.dc.gov 855-363-0333. You can also receive vaccine from local hospitals if you are a part of their patient groups. There are federally qualified health centers also offering vaccine to their patients, so contact them as well. And additionally, there are pharmacies in the area offering vaccine. So you can always follow this from our website. So as many residents who have been vaccinated and who have registered in the portal, there's still thousands of residents who've done neither. So we need you to get registered and get your vaccine because we know when our residents are vaccinated, we will be able to get back to more normal activities in the city and in the region. So this message is for DC residents, but also for the residents of the DMV. We were asked recently, let me go to the next slide, where these are the vaccination sites for walking up, which last week we talked about with DC Health, that residents over the age of 65 don't need an appointment. And they don't need to pre-register. They can go to these sites where we have listed the times here. This information is also available at vaccinate.dc.gov. I'll read through them quickly. Walter Washington Convention Center is one such site. Lamont Recreation Center, Langdon Park Community Center, Turkey Thicket Recreation Center, Arena Stage, Rosedale Recreation Center, Kenilworth Recreation Center, Bald Eagle Recreation Center, and those are for people 18 and over, and for residents of Ward 7 and 8. Also the Entertainment and Sports Arena, also in Ward 8, and Fort Stanton Recreation Center. So once again, seniors, go to those sites at the prescribed times and get your vaccine. Homebound residents can now also call to register for an at-home COVID vaccination appointment. This is if you cannot get to to one of the sites that I just listed, or to your doctor. These appointments will begin Monday, April the 26th, and the call center hours are listed there. Again, you're calling the vaccine hotline at 855-363-0333, and let the call taker know that you are a homebound resident. We also want to launch today a new way to get tested. DC is now offering free at-home COVID testing kits at 16 locations around the district. You can find out more at testyourself.dc.gov. The pickup hours are 10 to 6, and the drop-off is before, if you drop it off before 8 p.m., 7 days a week, those samples will be collected by DC Health. The drop-off sites are listed here, and this is in partnership with the library. You notice libraries in all 8 wards, which are operating as the drop-off and pick-up sites. We also want to ask people to help us get more people registered and vaccinated. We will have a day of action on May 1st, May 1st. And for more information, you see the link there. We've had a successful Vaccine Buddies program, successful Faith in Vaccine program where trusted people are talking to their neighbors and coworkers about getting vaccinated. This is a bigger extension. We need more hands on board, more volunteers to help us. With a grassroots outreach to knock on doors and to help people get signed up so that they can get vaccinated. Again, that's going to be on May the 1st, and the Canvas start times are 9 a.m., 11 a.m., and 1 p.m. Please sign up to help us get back to life in the district by getting everybody vaccinated. Now, let me start with another general government operations update, and that's why I have invited Deputy Mayor Babers to join us, because this update involves where we are with parking enforcement, towing of illegally parked vehicles, and requirements to renew vehicle registrations and inspections that have been extended during the coronavirus public health emergency. You see the list below of the things that have been on pause that will restart in the coming weeks. First, let me start with the earliest, June 1st. All parking enforcement will begin. Again, that's been on pause largely, except for public safety violations like blocking crosswalks and bus stops and the like. Towing of vehicles violating parking zones, street sweeping and sweep enforcement. Vehicles must display a valid DC registration and inspection sticker. New tiered residential parking fees that was enacted by the council, I think last year, will now go into effect. Parking, photo, and minor moving violation tickets issued after June 1st will be subject to adjudication hearing timelines listed on the back of this ticket. Okay. Beginning July 1st. Booting of vehicles with 2 or more unsatisfied tickets that are over 60 days old. All DC driver's license and ID card holders must display a valid credential. Renewal applications accepted for occupational and professional licenses. DC Medical Cannabis Program patient or caregiver registrations cards must also have a valid expiration date. So today is April 19th. We're asking everybody to look at their vehicle registrations and inspections, their driver's licenses and ID cards, and of course to be mindful of all parking regulations and all driving regulations. We have been on a pause during COVID to permit all of our staff to recognize social distancing requirements, and we are beginning to come out of that posture. The dates that you should pay attention to are June 1st and July 1st, and today. Because today the DMV is scheduling appointments for you to handle all of your business with the DMV, as they have been. And over the last several weeks, they have been making increasing numbers of appointments available. So Deputy Mayor Babers will be able to answer programs about that. We are also very pleased that at the same time, our team has been working very hard with the DMV, with our budget office, with the OCFO as well, to craft a ticket amnesty program. I also want to acknowledge Councilmember Trayon White, who has been very vocal and working with us to get this program launched as well. So what we are announcing is a new 4-month ticket amnesty program where we will give drivers the opportunity to pay outstanding tickets for parking, photo enforcement, and minor moving violations. Drivers eligible for the amnesty program are still obligated to pay their original ticket amount. However, penalties will be waived. So for some, this will be a huge benefit and an opportunity to move towards having their registration and credentialing correct. The amnesty program will run from this June 1st, to September 30th, and include tickets before September 30th, 2021. More information can be found at ticketamnesty.dc.gov. So again, if you have tickets, you will have to pay the original ticket, but not the doubling, not the fines and that go along with it. So now is the opportunity to get this your affairs taken care of with the DMV. We also want to make residents aware that library hours are being expanded starting May 3rd. DC Public Library will add Saturday hours, and you can see the Deanwood and Southeast libraries will begin providing limited in-person services as well. Sorry about that. Okay, and next. And briefly on recovery, and this is very, very important. The Restaurant Revitalization Fund is now up and running. The U.S. Small Business Administration released information about applying for the $28.6 billion fund, which will provide emergency assistance to restaurants, bars, and other qualifying businesses. Did I get the date right? I think it's available now. So get ready to apply by going directly to the SBA, sba.gov/restaurants. The program will provide restaurants with funding equal to their pandemic-related revenue loss, up to $10 million per business. The SBA also expects to reopen the Shuttered Venue Operations Grant application portal soon, and we will keep you up to date on that. Through this $16 billion program, eligible applicants may qualify for grants equal to 45% of their gross earned revenue, up to $10 million. So please stay connected to sba.gov for the Restaurants Relief Fund as well as the Shuttered Venue Fund. And lastly, continue to go to Stay DC. This is the district's new emergency rental assistance program made possible by federal grants to help households unable to pay rent and utilities because of COVID. You may call 833-478-2932 or 833-4-STAY-DC or visit stay.dc.gov. So with that, we'll take your questions. Sam.
Yes, Mayor. This is kind of off topic, but can you talk about the cities getting ready for the verdict in the Minneapolis trial?
I can tell you that the chief of the police and the director of DC Homeland Security have been coordinating and preparing for several weeks, probably before the trial even began. We continue to hope that justice prevails in that trial. We also want to stay focused in our city on making sure that everyone is safe. So we have a request into the Guard. Chief Conti has also put our police force on 12-hour shifts, which enhances our response capability. And that's been our posture for about a week.
And tell us a little bit more about your request for the National Guard.
I'll ask Chris to talk about that.
Yeah, thanks, Sam. So we put in a request to the National Guard a little over a week ago. We're requesting on behalf of the Metropolitan Police Department some assistance at traffic locations downtown, as well as some enhanced security for our metro stations in the downtown corridor, as well as a quick reaction force that can be deployed anywhere in the city in the event of large-scale protests. So again, all precautionary measures and all requests for support from the National Guard.
So they are going to be armed in some cases?
Well, I think that's important. It's important to note that they will not be armed. The only authority that can arm the National Guard is the President. And so we did not request any armed assistance for Guard support.
But our request is pending.
Okay, so it hasn't been approved yet.
It has not.
Okay. Last, Dr. Nesbitt, a question?
Of course.
Dr. Nesbitt, you said wash your hands, and I noticed Dr. Fauci says the same thing. How important is wash your hands in the case of coronavirus? Is there any indication that it is transmitted by touch?
So you wash your hands to avoid being able to expose yourself to any bacteria or viruses that are out in the environment that you may touch on a surface. So I'd ask you to think about it this way. If you coughed and then you ate, or you coughed and you touched something and somebody else touches that same thing immediately, and you touch your face, right? So all of this touching of your face that may have respiratory droplets and active virus on it creates a risk. So we want people to wash their hands, one, just because it's good community hygiene and it decreases the spread of a host of viruses and bacteria, including COVID-19. While the primary mode of transmission is for someone to inhale respiratory droplets or particles that have active virus in them from someone else who coughed, sneezed, is speaking loudly, singing, etc., there is still the ability for you to expose yourself if you have the virus on your hands and you touch your face. Then you increase your risk of exposure. So you should wash your hands before you consume any beverages. You should wash your hands immediately after you blow your nose, cough, sneeze, or any of those things. And you should also avoid touching your face. And that's like outside of COVID, right? Like we should just be doing that.
Stephanie.
Good morning, Mayor. Can I ask you your response to, are we looking at a new norm in the district wherever there's national tension now here in the city, the government, business owners, residents have to prepare for unrest?
I don't know I don't know. Let me put it that way. And certainly every situation we approach with the facts that we have in hand. I don't know that we have made a blanket statement about that. One of the blanket statements that I've made is if there is a joint session of Congress, that I think that should always be a national special security event. We think that it's been confirmed when the State of the Union will be, and I certainly hope that that type of planning process for security will be in place. But speaking of how we will police and provide for public safety, not just the police, but fire and EMS, DC Health, DHS, which are always a part of our First Amendment demonstration preparations. We have to evaluate that. What we've done is evaluate that for each event.
And then can I ask your response to what was seen in the district this weekend? Saturday, 4 people arrested, there was vandalism. Do you feel that these were protesters who were actively, there for protesting racial tension and, justice in the policing system? Or do you feel that these people were, had other motivations given?
I can't speak to the motivations of the people who were arrested, but certainly I know that our officers, felt like they had to be arrested. So I don't know if you have anything specific about the arrest motivation or the arrest reasons.
Thanks, man. And of course, I would defer to the Metropolitan Police Department, but we did see some water bottles, fireworks being thrown at the police line, and certainly there was some property damage as well at isolated parts of the city. So any further information I'd have to defer to MPD.
Are you all, in terms of what you said, having to prepare for, are you concerned that we're going to see more of this should, there be a verdict that people do not agree with this week?
I think as a nation, I think that's the posture of law enforcement and big city mayors certainly, is that we are, it's our job to prepare for the worst. Yes, Julie.
Thank you. I wanted to ask about the term 4 for DCPS. I saw that there are 1,700 students coming back to school in Ward 3 and just 48 or 47 in Ward 7 and 8. Can you tell me about any plans to increase confidence in Ward 7 and 8 families over the summer so that more kids will get back to school in the fall?
Kids will be required to come back to school in the fall.
Required?
Yes.
Will there be a virtual option for families who do not want to send their kids back to school
For
in
families
person?
who, if they have a need not to be in school, then that will be evaluated.
So that it will be more than what we have right now, where it really is just a family's choice. They'll have to demonstrate a specific need.
That's correct.
Interesting. Okay. And can you explain sort of how that will work and what you'll do over the summer to increase that confidence so that families cooperate with that?
I certainly we will have more to say, but I think what we've largely heard from families is they want to kind of turn the tide of learning loss. They want their kids to be in safe school buildings with their teachers. We continue to talk to families about all the preparations that we have made to do all of those things. We communicated to our families and our staff and the district at large the district's preparation to be ready for the start of school on August 30th. But meanwhile, Julie, there will be lots of opportunities for in-person learning for the remainder of this year. And throughout Term 4, families may continue to opt back to their classroom where there's space available. So that can continue to happen in Term 4, as well as lots of summer opportunities with DC Public Schools and with the Department of Recreation and with the Department of Employment Services. So we know that there's a lot that we want to do to engage our families. We recognize, like right now, after being out of school for more than a year, some families are deciding that they're into their groove, they're happy with that situation, and may not want to change it now, but they too are looking forward to a more normal schedule.
Thank you so much. Can I ask one more question?
Sure.
On parking, it says that there's a new tiered residential parking permit fees. Can you tell us more about that? Are the fees changing for?
Yes, and let me ask Deputy Mayor Babers to talk about the council's legislation that's starting a new program for residential parking.
Thank you, Mayor. So the tiered RPP is actually an increase in fee and then also a tier. So right now, RPP is $35. So we are encouraging people that if they want to pay the $35, they need to do so before the June 1st start date of the new tiered RPP. Starting on June 1st, RPP will increase from $35 to $50. That is for the first vehicle in the household. The second vehicle in the household will be $75. The third vehicle in the household will be $100. And then any additional vehicle in the household will be $150. Now, if there is a senior, a person who is 65 years old and older, then their first vehicle will be $35. So it will go from $25 to $35 for the senior.
Thank you so much.
Any other questions? Yes, Amanda.
Hi, thank you. A question on unemployment. So I understand that many residents have seen an interruption to unemployment benefits since late March due to the systems update related to the American Rescue Plan Act. DOE said over the weekend that the systems update has been completed. So is it your understanding that individuals who were able to recertify this past Sunday successfully, but also via email in weeks prior because the portal wasn't working due to the systems update, is it your impression that those people will be paid by Wednesday and their back pay included?
I don't know the answer to that. The director did confirm with me that those updates were complete. It sounds like you already got that report as well. I don't know if there are people who are, you're asking that if they couldn't get the changed benefits?
Right, so people have seen an interruption, they haven't been getting paid. And so, for example, I know I've spoken to claimants who've been recertifying via email. They've been emailing this link that DOES has given them these past 4 weeks. And so I guess my question is if they should expect to be paid by Wednesday as was.
Okay, let me see if I can get the answer to that before we wrap up.
I appreciate that.
Okay.
And then a second question, United Medical Center tells me that they are no longer vaccinating Maryland and Virginia healthcare workers, only DC ones, citing a new DC health policy. Could you confirm this policy? Is DC Health only vaccinating non-residents who pre-registered through the portal? Can you just offer some insight?
For essential workers, yes. So you're talking about essential workers, right?
That's correct.
Essential workers are in our portal. A hospital and other medical providers are focused on DC residents.
Understood, thank you. And sorry, a last question. The homebound initiative, so it looks like it's no longer being delayed. Appointments are starting this Monday. Do you expect to use the J&J vaccine, or are you, because you expect the pause to lift, or are you pivoting to Moderna?
No, I want to make sure you clarify that last week the program was not live because the program wasn't ready to go live. And we had a discussion where our preference, again, for any home visiting program that uses vaccines would be more efficiently executed or implemented with a one-dose vaccine. However, it doesn't preclude us from being able to use 2-dose vaccines out in the community. So our goal for beginning vaccinations is the 26th. If we can begin it before then with a Moderna product, we'll do so. So just managing expectations. What we would like to happen is for people to begin to call us now to get set up for those appointments. We already have some individuals who've been identified through partnerships with the home health agencies, Department of Healthcare Finance, Department of Aging and Community Living, et cetera. And we'll get to those individuals, but it's the logistics of how you implement these types of initiatives, whether you're using single-dose or 2-dose vaccines, require a bit of planning. So we're not going to go out in the field with 2 people registered. or only 2 people identified, right? And if there are 30 people, but they all live in different parts of the town where we may not be able to get to them efficiently with the vaccine within the number of hours that it could be would be used, and we have to wait and make sure we have enough people actively enrolled. So amplifying this program, making sure people call in is going to be extremely beneficial. We expect that a disproportionate number of these folks will be seniors, but we know that people are homebound who are less than 65 for a host of reasons as well.
Thank you.
Thank you. Hi, Mark. Yes.
Good morning. Yes, if I could just follow up quickly on the National Guard question.
Yep.
Can you tell us how many National Guard troops were requested? And if the request is still pending, isn't that a problem that we saw on January 6th?
It's a problem. It's absolutely a problem. I don't want to discuss the specifics of the requests at this point, but I expect that it will be resolved.
Okay, and then if I could go back to the parking, when you start enforcing again, and I'm sorry I didn't read the comprehensive list, but will you also be turning back on the one-way rush hour traffic, like on Connecticut Avenue, where lanes shift outward and inward during rush hour?
We will not. And I shouldn't say that. Let me just say this. This announcement doesn't address that. And if we come back with some more traffic movement changes before then, we'll advise that.
And then could you or Dr. Nesbitt or both comment, we have now had another university announce today, GW, that they're going to require vaccinations from faculty, staff, and teachers before returning to campus. Just your thoughts on that?
I love it. Well, that's,
Ditto.
There's a medical view perhaps, but let me qualify that by saying, especially for students, we miss our university students and our universities and the vibrancy that they bring to our city. We know that the students miss college life, and we also know that it will help with all of the university operations, including their ability to bring their staff back. So we think that it's a great idea. It's good that these announcements are being made early so that the young people are making a plan to get vaccinated at home before they come to school.
So if you think it's such a great plan, do you think it should be expanded to businesses doing it or DC public schools doing it?
Well, the vaccine is not approved for our public school students at this stage, so that's not going to be a requirement for the fall.
How about private businesses or government agencies?
They don't have students.
No, for staff. I'm saying the universities are requiring staff to get it too. Would you?
I'm not aware of them requiring staff, but I know that they're
announced that today.
focused on students. And let me tell you why this population is different, because they're coming from all parts of the country and the world. And they're coming to the district. So I do think that this is a different population. But Mark, you're raising questions that I know that we're going to be grappling with for weeks and months to come about mandatory vaccination. And so the district at this stage, the government doesn't have a mandatory policy, although we do require vaccinations in other manners of our operations. So DC Health, DC Homeland Security, and all of us will continue to research that activity.
And then my last question, I
Yes.
appreciate it. You talk about discontinuing the council EOM weekly briefing by phone. In response to that, Chairman Mendelson has scheduled a hearing, which he says will be a weekly hearing starting this Wednesday, where he's requested Dr. Nesbitt, Director Rodriguez, and I believe the city administrator as well. Will they all appear at that? Will you have your executive staff show up for that hearing?
Well, certainly we want the council to have the information that they need, and we will continue to work with them to get it. I don't really have anything more to say about this Wednesday right now. Yep, James.
Got a question for Dr. Nesbitt and two questions for you, Mayor.
Yep.
Dr. Nesbitt, we know that J&J, Pfizer, Moderna are the vaccines in the city. You do have Novavax, which is in the process, and AstraZeneca, if it gets its act together, it'll be in the process. Could you talk a little bit about if those two are approved by the FDA, how they'll come into the mix here in DC?
Sure, thanks, James, for the question. We continue to monitor the FDA emergency use authorization process for all pharmaceuticals that are used to either prevent COVID-19 or treat COVID-19. As we have done with the first 3 vaccines that were authorized for use in the U.S., is that they become integrated into our broader program. You remember that they weren't all approved on the exact same day. So we had Pfizer initially, then Moderna, and then the Johnson & Johnson or Janssen vaccine. And so our approach is to continue to encourage residents to get the vaccine that is available for them at the time of their appointment. All of the vaccines that are authorized are considered to be safe and effective, and so we don't want people to delay vaccination seeking a particular vaccine to be authorized or to be made available in the U.S. Along those lines, the federal government has seemed on, based on our understanding, to follow the same model for distributing what vaccine supply they have available. So what that means is that the Pfizer vaccine, whatever number of doses they have that they're going to send to states based on the resident population, they've used that same approach in terms of allocating via resident population for all 3 vaccines.
Mayor Bowser, we're in budget season, and a council member said publicly on Saturday that she just considering, sponsoring legislation that'll have a one-time stimulus check for district residents. She says she's just considering it. She didn't talk about an amount. As you draw up the budget, do you have any thoughts about possibly giving district residents with qualifications a stimulus check similar to what's done on the federal level?
Well, we've done that, as you know, James. In January, it was a subset of our people who are receiving unemployment. So as we look at emergency, as I think about it, we had the response to COVID, the relief period, which we're very much still in, providing relief in the form of business relief, individual relief, that are helping people make ends meet, but take care of their families, and at the same time helping our economy. So all of those relief issues are important. We are taking a very how should I say, a thorough look at all of those programs, and also all of the how the federal money can be spent, because we want to be able to provide that relief, but we also want it to be in accord with our federal guidelines.
Last question. As you know, President Biden will deliver an address to Congress.
Yeah.
Congress. It won't be a State of the Union.
Yes, correct.
On April the 28th. Have you gotten any indication from the administration? Have they invited you to the address?
I don't know. That invitation typically comes from the Congress. Okay, last round. I'll start with Julie.
As the parking enforcement comes back and people need to renew their driver's license or their registration or parking, people have had a very, very hard time getting DMV appointments. Are there processes in place to make that easier?
I don't know if people have tried lately, because over the last several weeks, in preparation for us getting back to normal with having people have up-to-date credentials and follow parking and moving regulations, we've been able to add more appointments. We're trying to give people a very long runway. It's April 19th. We're start for the credentials. July 1st is the day that we want you to be current. So let me turn to Deputy Mayor Babers to talk a little bit more about scheduling appointments.
Well, first of all, let me just confirm. A vehicle registration renewal cannot be done in person, not since 2009. So if you need to renew your vehicle registration, you should either go online or you should do that by mail. And so, you know, if you make an appointment for that, then DMV may cancel that appointment. For renewal of your driver's license or your ID card, if you have a real ID credential, which means you have a black star in the upper right-hand corner, then you also do not need to make an appointment. You can renew that credential online or by mail. Only individuals who are not what we call real ID compliant need to make an appointment. So we do want to make sure that only people who absolutely need to make an in-person visit do so. For the renewal of your inspection sticker, it is first come, first serve, and the inspection station, quite frankly, is waiting for you. I visited them 2 Saturdays ago and just drove right in. So we need people who need to renew to go ahead and to visit 1001 Half Street Southwest to get that inspection renewed.
Thank you. And I just wanted to make sure I understood Amanda's question about hospitals not offering appointments for essential workers who live out of state. Is that a hospital by hospital choice, or is this a DC health policy that says those vaccines are only for DC residents?
It's DC health policy.
Okay, and that's a new policy?
And it's not for workers is what we're talking about. For patients, the hospitals are vaccinating all the patients who need vaccinating.
Whether they live in DC or not?
That's correct.
But now for workers, it's
Yes,
just in-state
and keep
workers.
in mind that workers have been getting vaccinated since December 11th. And now all of the states have the same eligibility criteria, which is if you're over 16, you can get vaccinated where you live.
Thank you very much.
You bet. Sam?
For Ms. Baber, so if you had a ticket, let's say in 2019, and it doubled or tripled, it doesn't triple, I guess,
Let's
but
go back
doubled,
to the amnesty slide.
and you hadn't paid it, so any ticket before September 2021 is a face value. You pay what's on the face value of the ticket.
Correct. We realize that due to the coronavirus, there are many people who have been negatively impacted. And so the mayor did want us to do something that impacted a wide swath of our residents. It's not only for DC residents, though, it's also for non-residents. So we do encourage Maryland and Virginia residents who also have outstanding tickets to take advantage of the Amnesty program.
Do you know roughly how much money we're talking about here that would have to be paid if they paid it?
If everyone paid, it's probably about 400 million.
$400 million.
Right, but recognize that everyone
Doesn't pay.
does not pay,
Right.
correct.
Okay, but do you know roughly how much it would be if people took advantage of this?
Of the Amnesty program,
Yes, ma'am.
probably 50% of that, 50% of 400 million.
Thank you.
Yes, Stephanie?
Just a quick follow-up to that 400 million. That's since 2019 or since the pandemic went into place?
No, that's all outstanding tickets.
All outstanding too. Thank you. And then, I don't know if this is for Mayor Bowser, Dr. Nesbitt, or Director Rodriguez, but there was reporting on Capitol Hill Baptist Church that was denied an immune section. Can you talk about the reason why that was denied? And then also separately, can you all weigh in on where you stand right now with businesses and churches, different entities, only, requiring people to have proof of vaccine to be allowed in at this time?
Dr. Nesbitt, do you
Sure.
want to start?
So we've presented here quite a few times, and I've had other opportunities to reiterate that the way that people who are vaccinated, fully vaccinated, can behave in our community is still relatively limited in terms of those who are not vaccinated. And there are a number of reasons for that. What we are trying to keep people mindful of is that we have made guidance available about what fully vaccinated individuals can do. And right now, that guidance is specific to interactions in private homes. We have not expanded that guidance to create what fully vaccinated people can do out in public spaces, which would include places of worship, theaters, entertainment venues, et cetera. To that end, it is extremely difficult and impractical for us to believe that people coming into an enclosed environment who are vaccinated should be able to sit shoulder to shoulder with people who are not in their household, should be able to participate in certain activities that are higher risk, such as singing, be encouraged to shake hands and hug. We're not in that space in terms of what fully vaccinated people can do in public venues and facilities.
Okay. Yes, Amanda?
Just a final question. Would you consider ending your outdoor mask mandate, considering what we're learning about how the virus transmission outside and also more people getting vaccinated?
Well, I haven't gotten that recommendation from DC Health as yet.
Can I ask the director?
Yep.
what she
No,
thinks?
no, we are not making that recommendation. You will notice that everything that we produce reminds people to wear their mask, and that includes on sheets and documents that we give you in terms of when you are fully vaccinated. And there are a number of reasons for that. I appreciate the emphasis on your question, which suggests that outdoor transmission, the risk is lower than indoor transmission. But there are opportunities when people are in large gatherings, medium and large size gatherings, to still be exposed to the virus in an outdoor space. So we're not yet at a place where we're going to make that recommendation to the mayor to change our mask mandate. We also believe that encouraging everyone to wear a mask reduces stigma around mask wearing, and so we'll continue to move forward with our recommendation as is.
And I've got to say that our residents are doing an amazing job with mask wearing. I get comments from people who have visited here and are just really like they can't believe how well people maintain mask wearing. And it's got to be a major contributor to driving down infection. All right. Thank you, everybody.